Hello, and welcome to Stroke for Healing. I had a stroke on January 23rd, 2023. I have problems with the eyes. I can't see out of this ear, and the side of my face sometimes is numb. So I had a stroke, but that's okay. You can still do things. And as a travel entrepreneur for over 25 years, I've seen the changes that are occurring. And I can see how that has helped me today. But today I have a special guest, Dr. Aliancy, that I want you to meet, and don't forget to write. He has some tips to share, and I want you to meet him. Dr. Aliancy, welcome to Stroke for Healing.
Thank you, Eva. Hello, everyone. My name is Joe Francis Aliancy. I am a glaucoma specialist serving in the Claremont area.
Okay, can you tell me a little bit more about yourself and why I have asked you to be on our show? Because I want them to know that you are a doctor, and I want to know a little bit more about you.
Yeah, absolutely. Number one, thank you for the invitation and allowing me to be a guest on the podcast. And just a little bit more about me. I'm a medical doctor. In ophthalmology. I did most of my training here in Florida. So I went to University of South Florida for undergrad, and that's where I studied chemistry. So chemistry was my major then, and really, was exposed to science, research, and medicine. And that's the time in my life where I gravitated more towards being a practitioner. From USF, I went on to go to Florida State for medical school, Go Knowles. So that's where I first started studying medicine, and that's where I grew an affinity for ophthalmology, and so I was really exposed to some great mentors while at Florida State. Major shout out to Dr. Paul Winslow, Dr. Thomas Lawrence, as well, who really played pivotal roles in pushing me towards ophthalmology. And from Florida State, I then did my residency at Columbia University in New York, and it was a privilege being there. It was an awesome time. I had great preceptors, mentors, and I was able to really build that patient-physician relationship. I had amazing patients while I was up there. Then from Columbia, I then went to University of Michigan, and that's where I did my glaucoma training. So I did a fellowship in glaucoma, where I spent additional time to become an expert in glaucomatous optic neuropathy, along with other optic neuropathies.
Okay. Thank you for sharing. Mentoring is so important. I remember to be a mentor to someone else too, but I will talk about that later. So thank you, wherever where you're at, thank you for joining us. I have my first question to Dr. Aliancy is, what's the difference between an eye doctor and an eye specialist? More particularly, the optometrist? and the ophthalmologist and the neuro-ophthalmologist, what's the difference?
Yeah, good question. Good question. So, there's a lot of different titles, and sometimes I think they merge, and sometimes, it's a little bit shows a little bit of ambiguity in what the roles are. But to be frank, every member within the eye care community is vital. And there's a title that you didn't mention that I do want to highlight as well. But I would say, there's the optician, there's the optometrist, and then there's the ophthalmologist. And so with the optician, they are experts when it comes to crafting and creating and refining the perfect pair of lenses for your glasses. And so their handiwork, their craftsmanship will allow you to resolve your nearsightedness. It would help, resolve your astigmatism or your farsightedness. There's times when, where you've celebrated a good amount of birthdays and that ability to read up close is gone. It's called presbyopia. And they could help, create the perfect glasses to help resolve some of that. And still allow you to see at a distance with a great pair of progressive glasses. And so those are the opticians, and then with the optometrists, they have specialized training in identifying and diagnosing eye diseases. So you can go to an optometrist and they'll let you know if you have a worsening cataract. They'll let you know if you have macular degeneration. They can identify glaucoma. They can identify, stroke on specialized testing. And so the optometrist training is very unique in that, they do additional years after undergrad, just focusing on eye pathology. They focus on optics. They are experts when it comes to creating a personalized prescription for your glasses to improve your vision, or personalized prescription for your contact lenses. And depending on which state that they serve in, some optometrists have the ability to do some ocular lasers. But generally speaking, I would say optometrists, they focus mainly on identifying and diagnosing disease, and there's some treatments that they can initiate in terms of topical drops. And with the ophthalmologist, so we do a little bit of extra training in the realm of intervening in a surgical manner. So most ophthalmologists will we'll do cataract surgery, we'll do retina surgery, glaucoma surgery. There's surgeries that we will do in terms of, if there's an individual with a lazy eye, we could help realign the eye movements. And so that's strabismus surgery. And so within ophthalmology, there's a general ophthalmologist, which is a comprehensive ophthalmologist, and they deal with a breadth of different pathology. And then we have subspecialties within ophthalmology. So my particular subspecialty is glaucoma, but then there's also neuro-ophthalmology, there's uveitis subspecialists, there's retina subspecialists, oculoplastics. And so we all collectively, the optician, the optometrist, and the ophthalmologist, we all work together to provide, ocular health of excellence.
For sure that, because sometimes it's confusing. Now I know the difference. Do you know the difference? The notes, and then what do eyes and strokes have to do with each other?
Yeah.
What?
Good question. So your
recovery have to do together?
Yeah. Good question. So. So you're kind of wondering what is, the role of the eye provider, and how does that intersect with, a stroke victim or a patient that have gone through a stroke, and how does that intersect? To be honest, the the medical and recovery approach for a stroke victim needs to be comprehensive. Not just the eye provider, but there's the primary care physician that's involved. There is the neurologist that's involved. There's physical therapy that's involved, occupational therapy, and it goes on and on. And so as an eye provider and many other eye providers, we get to participate in that road to recovery for stroke patients. Our role is actually very important, I think. One, we actually can serve in the role, and not just with recovery, but with diagnosis. And so there's a lot of testing that we can do in the clinic to identify and diagnose a stroke. We're able to tease out between, a patient having a ocular-based disease or brain-based disease. And for the most part, we know that stroke is a brain-based disease, and so there's specialty testing that we can do to elucidate that. So not just the recovery portion, but we can be involved with the diagnosis portion. And then along with that, with the maintenance and the following of that patient. When it comes to recovery, it's having that right conversation with the patient, is understanding that with the stroke there is permanency. There is permanency in the deficits that have occurred, whether it's a change in your ability to walk, a change in your ability to control your urine, or a change in your ability to speak or to swallow or to see. And so this is going to be an ongoing relationship that happens, and so it's revisiting some of those deficits and seeing how it's going. And when it comes to being an eye provider, we actually can do a lot of baseline testing that will help determine the degree of severity of vision loss that is a consequence of the stroke. This is actually very important because, unfortunately, if you've had one stroke, there is the possibility of having a second.
Yes.
And so if we can have really good baseline data, after the first stroke, if there were to be some changes in the future, we can repeat a lot of that baseline testing to identify, yes, this is a second stroke, or no, this is some other disease process going on. And so that's actually quite important. And so as an eye provider, we get to be involved in multiple stages in the recovery of stroke victims.
What does have insurance that they can afford?
Yeah. So a lot of the times there is a distinction in the different type of coverages patients have. And so there's different categories of payment. So there's vision insurances that typically optometrists will take. There's some ophthalmologists that will take vision insurance, and those are primarily limited to corrective glasses, contact lenses, a good refraction. And then there is where medical insurance steps in. So, there's different payers. There's Medicare as well, which is government based, and Medicaid. And so this will represent reimbursement for health related, medical related ocular pathology. So the diagnosis and treatment of macular degeneration, diagnosis and treatment of glaucoma. And so there's instances where vision plan can be useful. There's instances where your medical insurance can be useful. But unfortunately, we do live in a world where there are individuals without any insurance or who are underinsured, and so this proves to be a very challenging undertaking. In those instances, there are opportunities where a lot of practices, including my practice, where we provide self-pay options. There's a lot of practices, including my practice, we provide payment plans or you can choose to pay for the services rendered over time. And so you don't necessarily have to have everything ready for payment, all at once. And I think that does, provide some advantages. It'd be nice to get to a point where we don't necessarily need to overcome, the cost of services, to provide care for all. But I think that's a different podcast.
Yeah, okay, thank you. That is very helpful to know. What should someone ask when looking for an eye doctor? What should a patient be asking when looking for an eye doctor?
Yeah, good question. Individuals that have a history of a stroke, there's deficits, residual deficits that sometimes make it a little bit harder to navigate through our society. My heart is that our society would get to a point where we are able to accommodate all, so a disability no longer truly become a disability. But we're not quite there yet. But what I would say is you would certainly want to have a provider and a practice that can help accommodate a lot of the things. And so just, sometimes it's some of the basics of being able to accommodate a wheelchair, right? It needs to be a practice that's ADA compliant. It needs to be a practice that has the infrastructure that's in place to be able to accommodate for that. And so I think that should go without saying, but I think it's worth mentioning. In addition to that, in ophthalmology, we use so many different technologies, and there's just constant novel technologies that's being, integrated within our practice. And so while we're making these advances, it's really amazing that we also have the forethought and mindfulness of making these same technologies accessible to all. One particular technology I'd like to highlight is, dual visual field testing. So this is testing that allows us to test each eye separately, and it helps us pick up any visual deficits, areas where you can't see well. This testing will actually highlight and show patterns of vision loss. And there's certain patterns of vision loss that's actually specific to stroke patients. And so this is really important testing and technology that we utilize in our practice. But even taking a step forward, there are visual field testing machines that in the past, were very large and cumbersome and very uncomfortable, and it wasn't very easy for somebody perhaps in a wheelchair or somebody that has, unilateral weakness on one side of their body. And so one of the things that, was important to me when starting my practice is, what technologies can I use that will, be accommodating for all? And one of those things was a virtual reality visual field testing apparatus. And so there's different companies out there, and they have a high level of sensitivity as well of diagnosing disease. But what's really nice about it is you can be in the comfort of the exam chair. You don't have to go into a small cramped room that's dark. You put a set of goggles on that's comfortable. It blocks all the light from coming in. And just in the chair that you're in right now, you've done it for me several times already. And you have a clicker, and then you could, be able to perform the test. And that would give us really good information. I really do have the thought of, the more comfortable you are as a patient, a lot of the times the better results that I'll get from the testing. And so that's something that's small, right? But I think it makes a large difference, being able to, find a practice that embraces the idea of, yes, taking on new technology and taking on new technology that will allow us to provide better care for all of our patients.
Okay.
Yeah. Hey, look, if you give me a second, I could think of some more things. I think accessibility is very important.
Yes, it is.
And there are some areas in Florida and the U.S. and the globe where there are physician deserts where there's not necessarily a high number of neuro-ophthalmologists or glaucoma specialists that could provide care to all patients that have had a stroke. And so it's something that it's a challenge that still needs to be met. And so hopefully this is a good plug for any individuals that are pursuing medicine or have the intentions of pursuing that to definitely continue. We need more providers. We need more individuals that want to commit to a life of medical care, especially within ophthalmology. But accessibility is very important. I think a great resource is going to be the local optometrist, the local ophthalmologist will be a huge resource to individuals, and there's something about being able to drive less than 30 minutes to get to your provider.
Especially when you get older.
True.
It's
true.
harder to go far away. Yes.
Yeah, that is true. That is true. And then, there's the fear of maybe driving at night, and so, you bring up a good point. When I think of, just within Central Florida, me as a glaucoma specialist, there's probably, 6 to 7 other fellowship trained glaucoma specialists, in the area, and there's a large population within Central Florida, and I'm considering anywhere from Melbourne all the way to Tampa, and so getting to a point where we have more specialized ophthalmologists is definitely a desire that could be achieved, but again, that's another conversation too.
Yeah. So you have to come back. Everyone stop all this. We should. So my next question: is there anything you would like to add? And
I think it's a very unique opportunity to be able to serve patients that have suffered from a stroke in the past.
Okay, what do eyes and children can we have to do together?
Yeah, good question. The question was, what does eye providers or eye care and stroke recovery intersect? I think that's a really good question. I think what you're asking is, how does eye care and patients going through stroke recovery have that allows them to intersect? I think that's a really great question. As eye providers, it's really important to just have the proper mindset when it comes to serving patients that have that suffered a stroke in the past, and understanding some of the deficits that could occur. And so what I would like to do is just highlight some of those things.
Okay.
I think one of the two.
Look at the
Oh yeah, absolutely. Yeah, I'm not used to looking into a camera. One of those two things that I would love to highlight is, one, the ocular surface. And what I mean by that is dry eye. And number two is visual deficits, and so vision loss, essentially. And with the first, with dry eye, I kind of hinted at this before, and how sometimes a stroke can lead to, certain deficits, including improper use or improper or decreased function of your eyelids, and how important and integral your eyelids were to your ocular health, or your ocular surface health. And so our eyelids play a very large role. Our eyelids are the first line of defense in a lot of situations. If something, a branch or a hand or a grandchild's toy is coming towards your eye, there's that reflex that's there. It's called the blink reflex that allows you to blink your eye and help protect your eye. This is actually a really interesting phenomenon. It's called the Bell's phenomenon, that when you blink your eye, your cornea, or the window into the eye, which is really important, along with your iris and your pupil, as you blink your eye, it actually moves up a little bit. And so these are amazing mechanisms that are put in place to really help, protect the surface of our eye. And but with the stroke, there is diminish of this blink reflex. There is diminish of use of your eyelids. And with that, it becomes increased ocular surface disease, including dry eye. And if dry eye is not properly treated and monitored, it can lead to corneal infections, corneal ulcers. Because the eyelid serves such an important role in, decreasing the bacterial colonization on our surface, when that function decreases over time, it can lead to increased bacterial infections on your cornea, corneal ulcers. And so to maintain good ocular health is truly important. There's actually a lot of different treatment modalities that we have to treating dry eye.
Yes. Very good to know. I have dry eyes, so it's good to know that there are different options to consider.
Yeah. Some of those options actually, are multifaceted. So we can focus on addressing the eyelid, right? There's some inert metals that we can put into the eyelid to add a little bit of weight to it, so that it could properly cover the cornea. That's one option, and that's where our colleagues within the oculoplastics world, would step in. There are some options where we directly increase the lubrication on the surface of the eye, whether it's with artificial tears, maybe artificial tear gel or ointment, and then there's some prescription grade eye drops that could also be used to help improve the ocular surface in terms of increasing lubrication, decreasing the inflammatory process that's around the ocular surface, and outside of medications and drops, there's actually stem cells that could be used, and so we have actually started using amniotic membrane stem cell material. We are able to cover your cornea with that material, with that stem cell, and it actually provides a lot of regenerative properties and really helps treat dry eye. And so all of this is, working in conjunction to improve and maintain the health of your ocular surface.
Okay. Well, thank you so much for sharing, Dr. Aliancy, and thanks for all of the people who are joining online. You are making a difference. Thank you for joining. And this is Stroke for Healing. Remember the hashtag and Stroke for Healing. And then, if you have questions, put them in the comments. And then I will be looking at the comments. And I'll say maybe look at the comments. If he doesn't see it, I have ways to get in touch with him. But, then don't forget to share this with someone it will help. And remember not to just share with anyone, but share with someone this can be helpful for them. If you want to know more about me or Dr. Aliancy, remember to put it in the comments, and then I can share with you. Okay? Don't forget, you are a blessing, but be a blessing to someone else. Well, thank you, Dr. Aliancy, for sharing. If you want to, that's only part one. Maybe part two will be coming much later. But thank you for sharing, and thank you, audience, for being here and listening and taking notes. Thank you.
Oh, well, thank you, Eva. Thank you. And I think it's time for your exam.
Okay.
Go ahead and take your glasses off.